for brain-associated and neurological illnesses. So he will take his viewpoint to look into the illnesses that's related to the nerve damages and brain-associated conditions. So let's welcome Professor Wang to give us this talk. Thank you.
Okay, thank you, Dr. Ye. Let's start my, this is my slideshow. First, thank you, Dr. Liuzhong Ye, for your introduction, and thank you, Dr. Shi Xiujun, for your first presentation. Very clear about the Liuzhong diagnosis. Okay, so now let's start my presentation. I'm Dr. Tianjun Wang from the London Academy of Chinese Medicine. My presentation with the topic of the post-coronavirus 19 related mental disorders and the TCM strategy. As Dr. Shi Xiujun has already mentioned, the post-coronavirus 19, the symptoms are very, very complex, very widely conditions. Actually, even from the early stage of the explored of coronavirus, not only in the first explored in China, but also in the Western countries, not of the medical practitioners and researchers has already noticed there are not of the symptoms out of lung of coronavirus. As we know, this we say coronavirus is mostly it's the lung or the bronchitis symptoms, etc. But actually, with time, there are more research has indicated not of other systems has been involved for this coronavirus as well. Even in the early stage, such as they have already noticed lots of the systems, such as the neurological system, renal system, hepatic system, gastrointestinal system, and the thromboembolic system, cardiac system, endocrine system, dermatological system. Already, as mentioned, this paper was published in early last year, about May or June this time. That is for acute cases. In this cases report, you can see this report from the Nature Medicine, which is one of the highest level of the medical journal. They have already mentioned the neurological diseases, including headache, dizziness, encephalopathy, Guillain-Barré disease, anorexia, stroke, etc., etc. So even in the early stage, they have already lots of symptoms out of lung, and already noticed that already in the neurological system and the psychological disease as well. And already the research, some research has already explored, such as from this report, they called Nature Neuroscience, that means the top journal. They mentioned the majority pathway of brain damage. Why the brain damage? So they noticed the neural invasion can occur at the neuromucous interface by transmucous and via regional nerve structure. This may be followed by transport along the olfactory tract of the central nervous system, thus explaining some of the well-documented neurological symptoms in coronavirus 19, including alternatively smell and taste perceptions. At the beginning, we may notice that this kind of the loss of smell and the taste was one of the monitored in early stage. And this research has explained why this happened. Recently, another important review article has published on the Nature Medicine. As you know, also mentioned, Nature Medicine is, I say, the top medical journal. This review article was published by several American researchers from about 10 to 15 universities. The summary about the focus review called the post-acute COVID-19 syndromes. So this is something like a summary or a review, the old material by so far, the commonly seen, the post-acute coronavirus symptoms. From this, the paper, how do they define the post-coronavirus symptom? They said, we define the post-acute coronavirus-19 as persistent symptoms and or delayed or long-term complications of SARS-coronavirus infection beyond 4 weeks from the onset of symptom. So as you may know, we have several different discussion or even argument about what is the post-coronavirus symptom. When we will say this is the post-coronavirus. So now this is, I will say this is quite common consensus. That means after 4 weeks from the onset of symptom, if the symptom is still there, or the symptom either this persistent symptom or the delayed symptom, we can call this is the post-coronavirus symptom. This is from, we say, the common accepted by the modern science. On this review, the summary from, we say, from today, the mental disorders or brain disorders, the summary is some of the existing study which award and funded by the national institution of the research, etc. He said, what are the physical examination and the brain imaging characteristics in those with persistent neurological symptoms in post-acute coronavirus-19? This is the research. The second one was what are the long-term psychiatric sequelae of coronavirus-19? So there are 3 other researchers has already registered as well. They are all interested on this area. In this paper, they summary and illustrated the commonly the key factors for coronavirus. First of all, how to understanding 4 weeks after the symptoms onset. We call this the post-acute coronavirus the syndrome. You can see from the minus week 2, maybe the patient has already impacted by exploded by the virus. Then from the minus week 1, that patient may have some symptom. At minus week 2, maybe they have no symptom. They got the virus but no symptom. But the minus week 1, the patient may have some symptom, but maybe their PCR maybe still negative. So that means maybe in week 1, in minus week 1, patient may have no symptom, but they have symptom, but they have no positive PCR check. So this gives us some notice. We need to be more careful. Even some patients, they have some symptom, but their test is still negative. They may be already suffered from this virus. Then from the week 1, this here week 1, that means the PCR could be positive. The patient may have some symptom from week 1, week 2. Yeah. So to week 1, week 2, week 3. This is the whole process we can see. Then until week 4, for most of the acute symptoms can be in very lower rate, or even most cases has no symptom already, and their PCR test may be negative already. You can say from the week 4 already. There are most of the cases where their PCR could be test negative. But from here, you can see the week 4, the patients may have lots of other symptoms until week 12 or even 6 months. You can say the commonly seen patient symptom, you can see from the symbol, you can say fatigue. We know based on my research or my clinical observation, more than 60% or 70% of patients, they have the first symptom will be fatigue. The decline in quality of life, muscular weakness, joint pain. The second common symptom from the lung is dyspnea, cough, persistent oxygen required, And the third on the list is the brain problems, including anxiety, depression, sleeping disturbance, PTSD. PTSD, as you may know, is the post-trauma stress disorders. This PTSD, as you may know, most commonly seen for the very severe attack, such as a pump or a war. But now, after COVID-19, some patients already suffered from PTSD. And cognitive disturbance, patient, maybe they call it brain fog, and also headache. So the brain injuries are one of the top three system suffering from the post-acute COVID-19. And also, of course, some of the chest problem, cardiac problems, and kidney problems, even hair loss. Hair loss is other symptom as well. So that's, you can say this imaging has highlighted the whole process of the virus attack and the process of the test of positive or negative give us a whole picture about this. So we need to be more careful about it. In this review, also the list summary of the post-acute COVID-19 by organ system, including the pulmonary system, hepatological system, cardiovascular system, neuropsychiatric system, renal system, endocrine system, gastrointestinal system, dermatotic system, MIC, etc. So almost all the systems could be involved with some of the COVID-19 syndrome. For today, we are more focused on the post-COVID-19 mental symptoms. Well, in this paper, they put the neurological and the psychological system together, including persistent abnormal diagnosis may include fatigue, myalgia, headache, dysautonomia, and cognitive impairment. Cognitive impairment is, of course, medical terminology. For patients, they mostly call this brain fog, something like fog. The other symptoms including anxiety, depression, sleep disturbance, PTSD have been reported about 30–40% of survivors. Similar to survivors of other pathogenic coronavirus as well. The pathophysiological and for neuropsychological neuropsychiatric complications is mechanismally diverse and entails immune dysregulation, inflammation, microvascular thrombosis, etc., etc. So they are quite various mechanisms. Then, in terms for the management, or in TCM, we use help or treatment for the post-coronavirus clinics. So they suggest they use the interdisciplinary management. For the neuropsychiatric the system problems, they suggest screening for anxiety, depression, PTSD, sleep disturbance, and cognitively impairment. So their suggestion here is, first of all, it's a screening. That means how to find them, how to diagnose them, how to select these patients. They are quite not. So this is the summary for this paper. So from this paper, they list some of the key research on the neuropsychiatric sequelae. So they say that coronavirus-19 survivors have reported a post-viral syndrome of chronic malaria, diffuse malaria, depression symptoms, and no restorative sleep. Non-restorative sleep, or we can say disturbed sleep. So individuals with COVID-19 experience a range of psychiatric symptoms persisting or presenting months after the initial infection. In a cohort of 402 COVID-19 survivors in Italy, 1 month after hospitalization, that means the person in hospital, approximately 56 screened positive in at least one of the domains in evaluation for psychiatric sequelae. Yeah. clinically significant depression and anxiety were reported in approximately 30 to 40% of patients. Yeah. A real-world large-scale data set analysis of 62,000 survivors from 54 healthcare organizations in the United States estimated the incidence of first and recurrent psychiatric illness between 14 and 90 days of diagnosis to be 18%. The more important, it reports the estimation of overall probability of diagnosis of a new psychiatric illness. That means this patient, not because of previously existing mental disorders, they are all new. About 5.8%, there are new cases happened. So, based on the review of existing data about the symptoms of post-COVID-19 mental disorders, now we move on. What's our TCM strategy? How to our TCM and understanding mental disorders? I'd like to slight review about the TCM mental disorder diseases. And I believe most of us have already had some basic TCM and knowledge. Here, just a very brief summary. First of all, most of all, we understand we have our TCM. We call we say Liu Ying Qi Liu Ying, that means the 6 external pathogens: wind, cold, hot, wind, damp, fire, etc. And also we have some internal, we call the 7 emotions, we call the Qi and the Zangfu organs. And we understand that for TCM, each Zangfu organ, they had one motion involved, including angry, happiness, worry, and scare, etc., for different Zangfu organs. And in traditional TCM, mostly we believe the heart controls the Shen. Yeah, mostly this is the common sense for the traditional TCM. So most of the TCM treatment for Shen, for mental diseases, we practice with the heart channel, heart Zangfu organ, heart patterns, etc. And also there are some the 5 Shen system we mentioned about the Hun and the Po, etc. Yeah, one typical the treatment for in classic TCM we called Sun Si Miao 13 ghost points. And as you may know from traditional Chinese culture, not only Chinese medicine, but traditional Chinese culture, that moment our Chinese people or Chinese doctors, they don't understand why this happened. They call these patients suffering from the ghost problem. The ghost attacked these patients. So in Sun Si Miao, about 1,000 years ago, he used a system of 13 points. They called Sun Si Miao 13 ghost points. Some points are still using, such as the ghost point Du Mai 26 Ren Zhong, ghost point Du Mai the 40 Du Mai 26 Ren Zhong and Du Mai 16 Feng Fu, still commonly used. Yeah, so these 13 ghost points are still commonly used to treating mental disorders, diseases. Recently, in the last 50 years, another we can say old system, but now new theory called the TCM Brain theory has been developed. So today we are more focused on this area. And if we say TCM Brain, actually, the originally TCM Brain, originally we can find the trace back to Huangdi Leijing time. It was one of the extraordinary Zangfu organs. The brain, the physiological function and the pathological changes are ascribed to the heart and corresponding respectively with the 5 Zang organs. this is for in classic TCM. Brain on its own has no patterns and not developed on its treatment as well. And organs in TCM are discussed with functions more than the form. So this is a very briefly about the brain in TCM. But actually, if we go back to the Huangdi Leijing time, originally in Huangdi Leijing, there were some argument about the role of the brain, such as in Huangdi Leijing, you call the yellow empire internal classic, or shortly the internal classic, as questioned by yellow empiric on Su Wen, okay, called the plain question, chapter 11, the different functions between the 5 zang. In this chapter, of course, they discuss about the different functions of 5 zang. Huangdi asked people, of course, it's translated. I've heard different comments from different physicians. Some take the brain as zang organ, some take it as fu. So this is quite the interesting statement. That means in that moment, 2,000 years ago, there were already some argument about the role, if it is zang or if it is fu of the brain. Yeah. Then we can review some other statements, such as this Huangdi Leijing Ling Su, chapter 10, with Jingmai or channels and the craters. They mentioned at the beginning of life, first by essence, then develops into the brain, with bones as the trunk, the channels of the pathway, the tendons as the network, and the muscle as the protective screen. The skin grows stirred, and then hair begins to grow. So from this paragraph, this indicate the brain is formed very first, then other tissues and organs, and then conditions other zangfu organs. Yeah, this is from Huangdi Leijing as well. Of course, there are some other statements in Huangdi Leijing in that classic TCM. We called in Huangdi Leijing plain question, chapter 13, we called the head is where the spirit locates. And also mentioned when pricking the head, if the brain is heard erroneously, the patient will die immediately. This from the plain question, chapter 52, the forbidden positions in pricking. And also they mentioned in the Huangdi Leijing Ling Su, chapter 33, about the sea. They carry the brain is the sea of marrow. So this is very clear. Brain is the sea marrow. So therefore, brain is considered to be of utmost importance and the vital part of life. Yeah. Unfortunately, due to some reason, the brain theory not developed by the 15th century. Of course, there are some research in the, on this area. Why? But from my understanding, one of the reasons was during the Han Dynasty in China, the Wuxing or 5 elements theory was commonly accepted to not only from Chinese philosophy, but also Chinese medicine. So they used the 5 elements to summarize the functions of zangfu organs. So 5 elements organize the 5 zangfu, so that there's no place for brain. So I think this is one of the reasons why brain theory was not completely developed until the 15th century. The famous herbalist or TCM master, we call it Li Shizhen, in his book, we call it Ben Cao Gang Mu. This Ben Cao Gang Mu was published in 1960, which was 3 years after he died. Yeah, as you know, in that moment, to publish a book is not so easy like today. Many doctors spend their whole life. They couldn't publish their book, but Li Shizhen is one of the sample. Only 3 years after he died, his book published. He pointed in Ben Cao Gang Mu, they called the brain is the house of the Yuan Shen, or you can say pre-modern mind. But unfortunately, he did not explain the detail and not developed. And how do we understand the brain is the house of Yuan Shen? So the Yuan Shen, we say, is the source of all the other Shen. Yuan Shen is the largest and the most honored Shen and dominates the life. Yuan Shen is innate and governed by the brain. And from the, as you know, from a reference of the Matthias Divania, he translated, he explained the brain is the residence of the original mind. From the Ming Dynasty onwards, some doctors attribute the residence of mind to brain rather than heart. So this is explained in his book called The Foundation of Chinese Medicine, second edition, by Matthias Divania. And about Yuan Shen and the Shen, recently I made more detailed research. And I'd like to first to explain some more detail on this area for our participants today. And this, some of these contents will be published on a journal soon. So the Yuan Shen and the Shen, and I will call the Yuan Shen and the Shen, how to understand it. The term Yuan Shen, or can say primordial mind, originally from Daoism theory. The Yuan means meaning original or primordially. In China, in Chinese language, we call the Yuan Dan. When we call Yuan Dan, that means the first day of the year. That means the first January of the year. So with that reason, we call Yuan Dan. That means the original, the first. So it was first mentioned in a Daoism book from the Song Dynasty around the 11th century. They called the originally characteristics is the Yuan Shen, 性质即元神. So in Qing Dynasty, Zhang Xichun, he said, Yuan Shen is a natural spirit with no thoughts and worries. From Daoism, Daoist perspective, there are two major kinds of Shen of the human being. One is Yuan Shen, another one is Shi Shen, cognitive mind. So there is a saying, Yuan Shen is a host in the brain, and the Shi Shen is host in the heart. There is one saying about this, the masters. The other statement about the Yuan Shen, they called, such as Master Han Dynasty, Dr. Zhang Dongjing, in his book, Jing Gui Yu Han Jing, he said, the head, the leader of the body, stores spirit. Then the master Dr. Sun Simiao, in his famous book, Bei Ji Qian Yi Yao Fang, he presents a similar understanding of this. From the Ming Dynasty onwards, more doctors paid increasing attention on the brain as the true seat of Shen, from which governs the other Shen. As a typical sample, Zhu Su and his colleagues in Pu Ji Fang, or prescription for universal relief, Pu Ji Fang states that the brain is the seat of marrow. The head is the meeting of all yang channels. The updantian is created in the Liwan, directly in question, the mud ball. All the Shen gathered inside the head, which is the leader of the body. So the head is the leader of the body. Understanding the head is leader of the body. In the later Ming Dynasty, Yu Jiayan, in his book, 1643, in his book, Yu Yi Cao, or in played meaning cases, he said, the head is the leader of the body, located on the top dome. It supervises the Zhang organs, but does not wait on them. Although eyes reach the liver, ears reach the kidney, nose reaches the lung, mouth reaches the spleen, and the tongue reaches the heart. They are borrowed as partial, but do not control him. It is the brain marrow, which is the head, that controls them. The brain is the seat of marrow. So this book explained more detail how to understanding the head is the leader of the body. So you also agreed that the brain is the collection of all the Shen, the head, leader of the body, store the spirits. It controls qi and blood, mind and marrows, channels and the collaterals, and also where the yang qi converges. So explain it more detail. In terms of the Daoism, from the Chinese characters, I believe some of you has some background or understanding about the Chinese characters, such as Roland, etc. The Daoism in Chinese, you can see the main part of the word, Chinese character Dao, is head. How in Chinese we call the shou, the head, or tou. This shou in Chinese character means the head. So although there are several different meanings of Dao, such as the head of shou, such as the road, etc., etc. But one of the meanings is thoughts and the principles. So as a sample of saying by Confucius is men of totally different principles can never act together. Yeah, this translation is very very important. I searched and now I find another in translation for the same word. 道不同不相为谋. Another translation is there is a little common ground for understandings between persons of different principles. So whatever different translation, but the Dao here, most translated is principles here. And Shen in TCM, yeah, we say Yuan Shen, now we move on to Shen. There are several meanings. The broad meaning of Shen is physical and mental energy. Physical and mental energy, we call the Shen. But the narrow meaning of Shen is mind or spirit. The essence and the qi are the substantially foundation of Shen. Okay, and also Shen is one of the three treasures we call the Jing, Qi, and the Shen. The post-natural Shen lives in the heart, but Yuan Shen refers to possession Shen or pre-natural Shen. Yeah. And the Shen in TCM, the state of Shen is said to be visible in the eyes. The healthy Shen produces bright, shining eyes with vitality. Yeah. Disturbed Shen produces dull eyes, which seem to have a curtain in front of them, as if no one were behind them. Yeah. Disturbed Shen often seen in those with long-term emotion problems or after serious shock. Even a shock that occurs a long time ago. Yeah. And so in TCM, the healthy Shen depends on the strength of essence, which is stores in the kidney and the qi produced by spleen and the stomach. Shen is dependent on the prenatural gene and the postnatural gene as well. If essence and the qi are healthy, Shen will be nourished. So essence, qi, and the Shen, they work together. Shen lives in the blood vessel, partly of heart system in TCM. This is about something about the Shen. So now, after this review about the TCM theory of the TCM Shen and the brain, so now we can summary about the function of brain. So I will summary, this summary also in my book as well. The main function including to dominate life, dominate our life, and also to operate the physical activities, including seeing, hearing, smelling, speaking, etc. And the brain to govern the mental activities. These mental activities including consciousness, intelligent, sleep, mood, etc. This is the general speaking about the function of the brain. If we make a slightly summary about the Yuan Shen and the brain, Yuan Shen is the central governor of other Shen, and the brain is the house of Yuan Shen. Yeah, brain is transported to the skull of head by the domain. Yeah, compared with other Shen in TCM, Yuan Shen is not explained in detail. Therefore, there were few treatment methods introduced. Even in the first statement in Ben Cao Gangmu, Master Li Shizhen did not explain the pathologic and any treatment methods. This is unfortunate. So this shortage has limited the development and the applications of Yuan Shen in TCM. This is unfortunate. So the summary of to regulate Yuan Shen and treatment of brain-related disorders may mostly be a matter of using acupoints or stimulation zones on the head. So as you may know, in traditional Chinese medicine, particularly in acupuncture, there are already, there are already 25 points on the head, which is already mentioned in Huangdi Li Jing. They said 5 times 5, 25 points. But actually, based on my research recently, also published in my book, I calculate in totally, there are 38 acupuncture points on scalp, on head. These are all traditional points. We still can use this traditional point to treating brain conditions. These points can be used as a local point for treating head and brain conditions. But mostly for traditional TCM, we use these points according to the channels, such as Dumai, such as foot Taiyang, the blood channel, such as foot Shaoyang, gallbladder channel, and hand Shaoyang Sanjiao channel, etc. They are all the yang channels on the head. They have some good the attitude for the channels, but on the other hand, it is not good enough. So with the TCM development now, some special technique developed, such as scalp acupuncture and Dao-qi technique, etc. So we move on for this treatment, etc. So about the development of TCM brain theory, the TCM has TCM has brain. First, TCM we can summary. TCM has brain, definitely, has no doubt. And the TCM, the brain controls the life and the mental activities, and also Dumai, we can say governor vessel, it's the channel of brain, as described in Huangdi Lei Jing. The source of C, Hai Lun, called brain is the sea of marrow. Its qi transfers to the top of the scale and lower the fengfu. Here, the lower fengfu is not only the fengfu point, but also the Dumai channel. As you know, the Dumai is the fengfu. So you can see on this picture, it's very clearly mentioned. The Dumai enters the brain at fengfu. This point, it's very clear. Make Dumai enters to the brain. Yeah. So and the scalp also scalp acupuncture, Dumai Meridian are the unique and the most effective method for treatment of brain. In terms of this Dumai of the brain, just by chance, last week my paper, this English paper published on the Acute, the Journal of Acute, which is the Journal of British Acupuncture Council, called Dumai, Channel of the Brain. On this journal, I explained about very briefly, about the TCM brain theory, the brain, the relation between the brain and the Dumai. And also in this book, I give a sample of the Dumai 14, the Dao-qi, we know Dao-qi, the commonly indications, not only to treating the traditionally Dao-qi indication, but also Dao-qi now commonly used to treating brain conditions. The reason because of this, the Dumai connected with it. And also another point on this book, on this paper, I mentioned nowadays some colleagues, some the TCM doctors and lecturers has study research about the bone, the Hui point of bone, and they suggest this point is Dumai 14 Dao-qi instead of blood 11 Da-zhu. I explained some the statement on this journal as well. I hope for if you're interested for that. And in terms of the Dumai 16, of course, from the traditional TCM knowledge, we can understand whatever from Huangdi Lei Jing, the brain is it's a sea of marrow. It transfers to the scalp and lower to the fengfu. That is we saw the reference from theory. But now there are some research from Western anatomy also indicate the connection on Dumai 16 area. Dumai 16 is above the cervical number 1. That is the location of Dumai 16. Now there is something like a new developed on the anatomy structure. They found between the C1 and the occipital bone, there is it's anatomy structure, very tiny bit. They call the myeldural bridge. This bridge connected the muscle to the dura. There is a bridge, they call B. Number B is, there are several bridges, A and B, but the B is more connected with the location of domain 16 Dao-qi. So if we need to Dao-qi to treating brain-related diseases, then the right depth is essentially important. If we only insert needle with half-turn points, etc., it is safe, but the function is not good enough to regulate the brain. So if we need to treat the brain disorders, our needle depth should be slightly deeper to approach or attach this, we call the myo, that means the rectus capitis posterior minor. So this needle minor, the muscle, this connected to the dura. It can directly connected for the brain fluid flow. Yeah, that is something like the evidence for why when we treating brain disorders, the depth of domain 16 needling is important, and also the meditation of Dao-qi is important. Yeah, for today, not detail but just give you some idea. Another typical treatment for brain disorders, including the mental disorders, we may use is the brain acupuncture for mental disorders. So there are, we say, the several scalp acupuncture areas are directly for the mental disorder, compared to the first version of the Professor Johnson Farr's scalp acupuncture are more focused for the neurological diseases. The second version has indicated there are several areas are good for mental disorders, such as the specific ones. From name you can see separate emotion area. It's here. The location is here. The location. When my teaching of this, some of my colleagues understanding this is the spirit emotion area. This is directly located on the front lobe, which controls the emotion functions. And we can use the head area, foot motor sensory area, manner control area, liver area, etc., etc. Of course, we can use the Dumai Dao-qi techniques, and also, of course, we can use the Renmai Dao-qi technique as well. Renmai, you know, located on the stomach. It is very closely related for the second brain or the new gut brain theory. This is the new theory from the medicine. And we can use ear acupuncture, leg acupuncture as well. So they have the technique we can choose. And most of my TCM brain theory has been published on my book we call the Acupuncture for Brain. I noticed some of my colleagues had already had these books. In this book, there are in totally 100,000 words. The first part of this book is Acupuncture for Brain, including the Acupuncture TCM Brain Theory and the techniques, including scalp acupuncture, Dao-qi technique, and the summary of the research on the acupuncture for brain, etc. Then the major part of this book we call the part B, but treatment of brain disorders. The first part of part B is neurological diseases, and the second part of this book for the treatment is mental disorder, including depression, anxiety, bipolar disorder, post-trauma stress disorder, insomnia, substance abuse, etc. So these are books. If interesting, you can go deeper. Okay, so to finish my presentation, I will shortly summary of my presentation. Increasing evidence indicate post-coronavirus-19 related mental disorders are wide and severe. TCM has worked very well against the post-coronavirus syndromes. TCM and acupuncture brain theory and the techniques may play a vital role against the post-coronavirus syndrome, including mental disorders. And in LACA, that means the London Academy of Chinese Acupuncture, diploma courses and lots of CPT courses will teach TCM brain theory and the techniques. Yeah, looking forward to discuss with you in LACA other courses. Okay, that's all for my presentation. Thank you.
Thank you very much for Professor Wang for a wonderful lecture today. just to give some more information about the theories about neuropsychological illnesses. Me and Professor Wang, along with a famous Professor Liuzhong Ye, has published 3 articles related to the COVID-19 pandemics. Last year, we had the 3, including one article about the early symptoms, differentiation and treatment, and also neuropsychological disorders associated with COVID-19, and also loss of smell and taste. First author was Professor Wang. So if everybody's interested in it, you can contact us, or you can Google, and the articles are available online. Okay, so now it's